Hello, welcome to Anatomy DAHAR series. Today's topic is the axilla. The diagram-based upper limb lecture. It includes practice questions at the end. Text slides are from 2nd to 20. Question slide is 21. Color code of the text. The basic anatomy must know in light yellow color. Clinical highlights good to know in light red color. Find points for the advanced readers in light blue color. Illustrated, prepared and presented by Dr. Abdul Hamid, Abdul Rashid. Axilla, the armpit. Look at the diagram. This is the anterior view of right half of the neck, right half of the chest, right shoulder and right arm. Introduction. The axilla in Latin means fossa or space. Plural called axillae. It is an anatomical term for the armpit, located between the lateral surface of the chest wall and medial aspect of the upper part of the arm. It is the gateway to the upper limb, a common passage for the blood and lymph vessels and nerves between the posterior triangle of the neck, the cervical, and the arm brachium. Thus, the axilla is also known as the cervicobrachial passage. More so, it is the site where axillary lymph nodes are located. Important clinically. Shape of the axilla. We have two diagrams here. Diagram A and diagram B. In diagram A, the arm is fully adducted. In diagram B, the arm is abducted. The shape and size of the axilla vary depending on the positions of the arm. When the arm is fully adducted in figure A, the axilla is just a fissure or cleft. But when the arm is abducted in figure B, the axilla becomes a wide fossa. For anatomical explanation, the axilla is regarded as a four-sided pyramidal-shaped fossa consisting of four walls, an apex, and a base, the floor. Walls of the axilla. Four walls of the axilla are anterior, posterior, medial, and lateral walls. You can see here, this will be the anterior wall. Behind here is the posterior wall, and this is medial wall, and this is lateral wall. The first three walls, that is anterior, posterior and medial walls, are broad, but the last, the lateral wall, which is a narrow angle where anterior and posterior walls converge laterally. We'll explain later. The anterior wall of the axilla. Look at the diagram. This is sagittal sections of the anterior wall of the axilla. This is anterior, this is posterior. The anterior wall of the axilla is the largest wall, formed by two layers of muscles. Number one, this is pectoralis major muscles in the superficial layer. Number two, pectoralis minor muscles, and number three, subclavius muscles are in deep layer behind the pectoralis major muscle. This is number 4, clavipectoral fascia, which encloses these two deep muscles, pectoralis minor and subclavius muscle. This is inferior border of the pectoralis major muscle. It forms the anterior fold of the axilla, that is, anterior axillary folds. It can be grasped between the two fingers. The posterior wall of the axilla. We are looking from in front, this anterior view. It is formed superiorly by the lateral part of the anterior surface of the scapula. It is covered by number 1, subscapularis muscle, number 2, teres major muscles, and with the tendon of number 3, latissimus dorsi muscle, which winds around the lower border of the teres major muscle. It forms the posterior axillary fold. The posterior wall extends lower than the anterior wall of the axilla. The subscapularis muscle is the largest component of the posterior wall. So you know what are the muscles forming the posterior wall of the axilla: subscapularis, teres major, and latissimus dorsi. The medial wall of the axilla. Look at the diagram. This is the medial wall of the axilla. It is formed by number 1, upper 4 ribs, with number 2, intervening intercostal muscles, covered by number 3, upper 4 digitations of the serratus anterior muscle, which is supplied by number 4, the long thoracic nerve, that is nerve of Bell, which descends on the outer surface of the serratus anterior muscle and supply to it. Usually, the nerve which supply a muscle lies deep to the muscle to get protection. But in this case, it is unusual. The intercostal brachial lateral branch of second intercostal nerve pierces the serratus anterior muscle to enter the axilla. See below. The lower limit of the axilla is defined as the level of the 4th rib. Muscles of the walls of the axilla. Transverse horizontal sections of the axilla. This is lateral, this is medial, posterior, and anterior. This is summary of the muscles of the walls of the axilla. Anterior wall is made up of pectoris major muscles, superficial layer, and deep to it is pectoris minor muscle and subclavius muscle. Posterior wall is made up of subscapularis, teres major, and latissimus dorsi muscles. Medial wall is made up of serratus anterior muscles. Laterally, anterior wall and posterior wall muscles converge laterally. The upper end of the humerus. Let's see the parts of the upper end of the humerus. This is the head of the humerus. This is anatomical neck of the humerus. This is surgical neck of the humerus. You can see 2 tubercles here. This big one is called greater tubercle of humerus on the lateral side. This is smaller one, lesser tubercle of the humerus on anterior side. Between the 2 tubercles, there is a groove or sulcus called intertubercular sulcus, which extends downwards and consists of lateral lip and medial lip of the intertubercular sulcus, and this is the flow of the intertubercular sulcus between the 2 lips. Prerequisite. We have 2 diagrams here. This is lateral view of the shoulder joint. This is glenoid cavity. Above the glenoid cavity, there's a small tubercle is there, called supraglenoid tubercle. This is anterior view of the upper part of the scapula. This is glenoid cavity. Above the glenoid cavity, there is supraglenoid tubercle is there. This is coracoid process, horizontal part, vertical part, and apex of the coracoid process. What are the muscles attached to the supraglenoid tubercle here? And what are the muscles attached to the coracoid process? We'll see later. The lateral wall of the axilla. This wall is a little bit more complex than other three walls. The anterior and posterior walls of the axilla converge laterally and attach to the respective lips of the intertubercular sulcus of the humerus. The lateral wall of the axilla is therefore a narrow angle formed by the flow of the intertubercular sulcus. This is the flow of the intertubercular sulcus. That is between the lateral attachments of the muscles of the anterior and posterior walls of the axilla. If you look at the diagram here, you can see the pectoris major muscles of the anterior wall is attached to the lateral lip of the intertubercular sulcus of the humerus, that is anterior to the flow of the sulcus. Continuation of the lateral wall of the axilla. The intertubercular sulcus. This is intertubercular sulcus. It has two lips, lateral lip and medial lip. In between the two is the floor of the intertubercular sulcus. The medial lip is attached by number 1 teres major muscle. So it is medial to the floor. The floor of the intertubercular sulcus is attached by latissimus dorsi muscles, which comes up, winds around the lower border of the teres major muscles and attached to the floor of the intertubercular sulcus. The lateral wall of the axilla. Continuation. These two diagrams I have already shown. This is glenoid cavity, supraglenoid tubercle. This is glenoid cavity, supraglenoid tubercle, coracoid process, apex of the coracoid process. Let's see the diagram here. The lateral wall of the axilla. Main structure is flow of the intertubercular sulcus between lateral lip and medial lips. This is supraglenoid tubercle. If you see this diagram, flow of the intertubercular sulcus is occupied by long head of bicep tendon, which arises from the supraglenoid tubercle. So long head of bicep tendon is between the anterior and posterior wall, coming down along the flow of the intertubercular sulcus. The lateral wall of the axilla. Continuation. Long head of bicep descends along the flow of the sulcus, which I have already stated earlier. It is overlapped by two muscles which arise from the apex of the coracoid process. They are number 3, short head of biceps muscle, and number 4, coracobrachialis muscle. Short head of bicep muscle is lateral and coracobrachialis muscle is medial. Both arise from the apex of the coracoid process. Therefore, the lateral wall of the axilla is formed by number 1, flow of the intertubercular sulcus, Number 2, tendon of the long head of biceps which descends along the floor, and it is overlapped medially by number 3, short head of biceps muscle, and number 4, coracobrachialis muscles. They arise from the apex of the coracoid process. The lateral group of axillary lymph nodes are located below, medial to the axillary vein. It will be around here. The base or flow of the axilla. This is the sagittal sections of the anterior wall of the axilla. The base or flow of the axilla, this is the one, is a dome shaped, composed of skin, superficial fascia, and deep fascia, which is axillary fascia, from superficial, that is below, to deep, above. The axillary fascia extends anteroposteriorly, that is from front to back, from anterior axillary fold to posterior axillary fold behind. And transversely, it extends from the fascia over the serratus anterior muscle on the medial side to the deep fascia of the arm on the lateral side. This is pectoris minor muscle. It is lower border. This is suspensory ligament, and this is the base of the axillary fascia. Number 1, the suspensory ligament from the lower border of the pectoris minor muscle is attached to the dome of the axillary fascia from above and maintain the concavity of the flow of the axilla. The axillary tail of Spence passes through the foramen of Langer in the middle part of the axillary fascia to enter into the axilla in woman. Apex of the axilla. As you know, the axilla is four-sided pyramidal shape, consists of four walls and the floor of the base. Opposite to the floor of the base is the apex of the axilla. Now let's see the diagram first. This is clavicle, this is first rib, and this is scapula. The apex of the axilla is bounded anteriorly by posterior surface of the middle third of the clavicle, medially by outer border of the first rib, posteriorly by upper margins of the scapula. Structures passing to the apex of the axilla are axillary blood vessels, that is artery and veins, divisions or the upper part of the cord of the brachial plexus, long thoracic nerve, and efferent subclavian lymph trunk. Apical group of the axillary lymph nodes are located behind the clavicle at the medial part of the apex. Contents of the axilla. Look at this pilot diagram first. This is four-sided pyramid shape. Section is transversely. This is transverse sections of right side of the axilla. This is medial, this is lateral, this is anterior wall, posterior wall, and medial wall of the axilla. This is the axilla cavity is here. What are the contents of the axilla? Number 1, axillary fat. Number 2, axillary artery and its 6 branches. Number 3, axillary vein and its tributary. Number 4, infraclavicular parts of brachial plexus, 3 cords and 13 branches. These are the cords of the brachial plexus. Number 5, long thoracic nerve, which will be lateral to the serratus anterior muscle, and intercostobrachial nerve, which is coming through the medial wall, traversing the axilla and go to the medial surface of the arm, we mention later. Number 6, axillary lymph nodes and lymph vessels. These are axillary lymph nodes and lymph vessels. And number 7, axillary tail of Spence in women. Contents of the axilla, right side. Look at this pilot diagram. This is four-sided pyramidal shape axilla. Now we are sectioning sagittal section, that is a vertical plane. So you can see this is the axilla seen from the right side. Okay, so this is the vertical section, is the sagittal section. So this is anterior wall, posterior wall. This is the base. So what are the structures containing in the axilla? Number 1, axillary fat. Number 2, axillary artery and its 6 branches. Number 3, axillary vein and its tributaries. Number 4, infraclavicular parts of the brachial plexus, that is 3 cords and 13 branches. These are the 3 cords. Artery and cords are surrounded by axillary sheath. Number 5, long thoracic nerve, which is the nerve to the serratus anterior muscles, descending on the outer surface of the serratus anterior, we have already mentioned, and intercostobrachial nerve, we are going to mention later. And number 6, axillary lymph nodes and lymph vessels. These are the axillary lymph nodes. And number 7, axillary tail of Spence in women. So we are seeing from another view. Previous ones are transverse section. This is sagittal section. Intercostobrachial nerve. Inter means between, costa means rib, intercostal means between the ribs, brachium means arm. The spinal nerve between the ribs is intercostal nerve. We have 2 diagrams in this slides, diagram A and diagram B. This is intercostal nerve. Intercostal nerves give lateral branch. Usually, lateral branch of the intercostal nerve divides into anterior and posterior branches. See diagram B. However, the lateral branch of the second intercostal nerve, T2, doesn't follow the rules. It gives lateral branch, but it doesn't divide into anterior or posterior branches like other intercostal nerve. This is axilla. This is medial wall of the axilla formed by serratus anterior muscle. The lateral branch of the second intercostal nerve, T2, passes through the medial wall, that is the serratus anterior muscles, go through the axilla and comes towards the upper part of the arm. This lateral branch of the second intercostal nerve will supply the skin of the floor of the axilla and also skins of the upper half of the arm, that is medial surface and posterior surface of the skin of the upper part of the arm, and it is called intercostobrachial nerve. Clinical highlights. The intercostobrachial nerve runs laterally between the lymph nodes of the central group of the axilla. Hence, enlargement of these lymph nodes, like in cancer, can cause the compression of this nerve, resulting pain along the inner surface of the arm. The long thoracic nerve, which descends on the external surface of the serratus anterior muscle, is likely to suffer injury, leading to the paralysis of the serratus anterior muscle and winging of the scapula. Subcutaneous fat between the superficial fascia and deep, that is the axillary fascia of the floor, often infiltrates through the deep fascia and spread the superficial infection to the deep part of the axilla. The axillary abscess may grow to considerable size before it builds up sufficient tension to cause pain. The pus of the axillary abscess may track above into the neck along the axillary sheath, may pass deep between the pectoral muscles through the clavipectoral fascia, or into the arm below. Base of the axilla is the most dependent part. Therefore, an incision to drain the abscess is usually at the base. The safe site of the incision of the floor for drainage of the axillary abscess is midway between the anterior and posterior axillary folds, closer to the medial wall to avoid injury to the great blood vessels and nerves which are located near the anterior and lateral parts of the floor of the axilla. The end. Please see related topics, that is axillary blood vessels, brachial plexus 1, brachial plexus 2, and axillary lymph nodes under Anatomy DAHAR series. Please subscribe. Illustrated, prepared and presented by Dr. Abdul Hamid Abdul Rashid. Thank you for watching.